in your fingers?
It's a bit uncomfortable.
A little bit uncomfortable? Okay. You can stop. Let's see. Lost my place here. Checking for lost my place. We're checking for crepitus. And I wanted to see if you have any crepitus here in your knee. So if you could just bring your legs out one at a time. Oh, she has some major crepitus in both of her knees. That just hurts me hearing that. I've checked distal pulses. Now I want to check heart pulses. Okay, and I'm going to first I'm going to listen with the diaphragm of my stethoscope, and I'm going to find that second vertebral costal space, and I'm going to start with the aortic. Pulmonic, Erb's point. You can lift your breath. And I'm going to start with tricuspid and the mitral. Okay. I'm also going to listen to her heart sounds with the bell of my stethoscope, and I'm going to again find that second costal vertebral space, and I'm going to start again with the aortic, pulmonic, Erb's point, tricuspid, and let's lift your breast again, and the mitral. While I'm here, I'm going to go ahead and listen to her lung sounds. As I said before, her respirations are non-labored. Her chest expansion is within normal limits. I'm going to go around and I'm going to check her, listen to her respirations posteriorly. Her lung sounds are clear bilaterally and throughout all lung fields per auscultation. Check capillary refill, listen to the heart. Now I'm going to go ahead and I'm going to have you to lay back on the exam table, please. Okay, and first I'm going to inspect, and her AP diameter ratio is 1 to 2. Her abdominal area is slightly rounded, but it's not protuberant. For the purposes of this exam, I wanted to respect the modesty of my patient, and so I'm not going to pull up her exam gown to look at her abdomen, but we will just say that it is also pink and warm to the touch. Okay, so I'm going to inspect, auscultate, listen to those bowel sounds. And I'm going to start in the right lower quadrant. Moving from the right upper quadrant to the left upper quadrant, and back down to the left lower quadrant. Her bowel sounds are active. I also want to note that the aortic pulsation is visualized. and her bowel sounds are active. And now I want to palpate. So I'm going to start with light palpation. I'm going to start in this again in this right lower quadrant. This is light palpation. Okay. Her abdomen is non-distended, and I'm going to go with the deeper palpation. I don't feel any organ enlargement. Oh, I need to look at her face too while I'm doing this. Okay, she's not showing any signs of tenderness in the abdominal area. There's no tenderness. I don't feel any enlarged lumps, bumps, masses, or enlarged organs in that area. While she's laid back in this position, I also want to listen again to her heart sounds. First with my diaphragm of my stethoscope. That's the aortic, pulmonic, herbs, point, tricuspid, and the mitral. Now I'm going to turn my stethoscope around. I'm going to listen to the heart sounds again while she's laying in supine position with the bell of my stethoscope. And again, herbs, point, aortic, pulmonic, herbs, tricuspid, and then again the mitral. While she's laying in this position, I also want to note that she does not have any edema in her lower extremities. Okay, Miss Stone, you can sit up, please. Okay. As I said before, her AP ratio is 1 to 2, and her chest expansion was within normal limits. Now I wanted to I'm going to check the musculoskeletal, and I want to check that spinal accessory nerve if you'll just shrug your shoulders. Okay, and can you do a large range of motion? Her range of motion and her arms is good. Okay, now I'm going to have you to, let's see, we're going to check reflexes. Going to check the patellar reflex. Okay, and I want to check for the clonus. So I'm going to raise your foot up. Okay, just relax your foot. Okay. No clonus identified. Okay. Okay. Tenderness there in your calf. Okay. Calf tenderness. And as I said before, she doesn't have any edema present. And her lower extremities are also warm to the touch, and her muscle tone is within normal limits. I also wanted to assess her gait, and if you could step down at this time and just walk across the floor. Her gait is within normal limits and steady. Okay, let's also do the Rosenbaum test at this time while you're standing, and that's I'm going to have you put your feet together, stand with your arms out, and touch your pointing finger to your nose. Close your eyes, and then touch your pointing finger to your nose one at a time. Okay, good. And she doesn't have any swaying, so that cranial nerve is intact. Help you get up here on the exam table again. Okay. This concludes my physical examination at this time, and I want to say that I have enjoyed Ms. Stiegel this semester, and I appreciate her answering my questions in a timely and professional manner. And I just want to say thanks again. And this is things that I will be continuing to practice in my professional practice as a nurse. And thank you. I appreciate it.